Did you know that by the time you finish watching this video, nearly 20 seniors will be diagnosed with dementia? That's one diagnosis every 66 seconds. But here's the part no one tells you. Dementia isn't always caused by aging. In fact, many cases are fueled by everyday mistakes, things you do daily without even realizing they're quietly destroying your brain and body. Researchers now estimate that up to 40% of dementia cases could actually be delayed or prevented if seniors avoided certain habits and medications. Yet most older adults are never warned about them. That changes right now. In this video, we're uncovering 8 everyday mistakes that quietly trigger memory loss, dementia, and painful inflammation in seniors. Each one may seem harmless, but together they can erode your health faster than you think. And mistake number 3, you probably did it this morning and it may already be reshaping your brain. Before we dive in, let me know in the comments, have you noticed brain fog, sudden forgetfulness, or more joint pain lately? We're reading every comment and giving personalized replies. Mistake number 8, overusing PM and nighttime medications. Think about your nightstand. Is there a little pink or blue pill you take to help you sleep or calm allergies? Medications labeled PM, Tylenol PM, Advil PM, most over-the-counter sleep aid often contain diphenhydramine, the same ingredient in Benadryl. Here's the danger. Diphenhydramine belongs to a class of drugs called anticholinergics. These block acetylcholine, a brain chemical that's absolutely essential for memory and learning. Without it, your brain literally struggles to form new connections. A study in the Journal of Geriatric Cognitive Health found that seniors who used anticholinergics like diphenhydramine regularly had a 54% higher risk of developing dementia. That's not small, that's 1 in 2. And the scary part, these drugs are marketed as safe. No warnings about dementia, just PM on the label. Millions of seniors think they're helping themselves sleep, when in reality, they may be quietly shutting down their brain's memory center, the hippocampus. Better option, if you need allergy relief, go for loratadine, Claritin, or cetirizine, Zyrtec, non-sedating antihistamines that don't cross into the brain. Mistake number 7, staying on acid reflux medications for years. Do you take something for heartburn? Maybe Nexium, Prilosec, or Prevacid? These are called proton pump inhibitors, PPIs. They're supposed to be short-term fixes, but many seniors stay on them for years. Here's the hidden danger. PPIs block stomach acid. Sounds helpful, right? But you need stomach acid to absorb vital nutrients, especially vitamin B12. Without B12, your brain cells can't make myelin, the protective coating around nerves. The result? Misfiring signals, brain fog, and memory problems. A massive study in JAMA Neurology followed over 73,000 seniors and found that regular PPI users had a 44% increased risk of developing dementia. And that's not all. PPIs also deplete magnesium and calcium, leading to weaker bones, cramps, and nerve problems. Even worse, new research shows PPIs may increase amyloid beta plaques in the brain, the same toxic protein linked to Alzheimer's disease. Better option, don't quit suddenly, but ask your doctor about tapering. Consider famotidine, Pepcid, as a safer alternative. And for natural support, try chewing deglycyrrhizinated licorice, DGL, or elevating the head of your bed to reduce reflux without long-term drug use. Mistake number 6, using bladder control medications without review. Embarrassing bladder leaks are common after 60. Doctors often prescribe medications like oxybutynin and ditropan. At first, it feels like a miracle. Fewer bathroom trips, fewer accidents. But here's the dark side. Oxybutynin works by blocking acetylcholine, the very same memory chemical affected by Benadryl. And unlike some weaker drugs, oxybutynin easily crosses the blood-brain barrier, targeting your hippocampus directly. In a BMJ study, seniors who took strong bladder drugs like oxybutynin for over a year had a 49% higher risk of dementia. That's almost half. The tragedy is that most seniors aren't warned. They think their forgetfulness is just aging, not realizing it's drug-induced. Patients describe losing track of conversations, misplacing items, or suddenly struggling to remember appointments. Better option? Ask your doctor about Myrbetriq, which controls bladder issues without blocking acetylcholine. Lifestyle changes like limiting caffeine and timed bathroom trips also reduce symptoms without harming your brain. Mistake number 5, aggressively lowering cholesterol with high-dose statins. Statins like Lipitor, Zocor, and Crestor are some of the most prescribed drugs on earth. They lower cholesterol to protect your heart. But here's what no one tells you. Your brain needs cholesterol. The brain is nearly 60% fat, and cholesterol builds the myelin sheath, the insulation around your brain's wiring. Without enough cholesterol, signals slow down, memory falters, and neurons weaken. A Frontiers in Aging Neuroscience study found seniors over 70 who used high-dose statins for over 3 years had a 26% higher risk of cognitive decline. Patients often describe sudden confusion or forgetting familiar routes while driving. Better option, not all statins are equal. Drugs like pravastatin and rosuvastatin don't cross into the brain as easily. If you're noticing memory changes, ask your doctor about alternatives, dose adjustments, or pairing statins with lifestyle changes like diet and exercise. Mistake number 4, relying on quick fix sleep and anxiety pills. Can't sleep? Feeling anxious? Millions of seniors are prescribed benzodiazepines like Xanax, Valium, or Ativan. They feel like lifesavers at first, but long term, they sedate the brain into decline. A 2022 BMJ study found that seniors who used benzos for just 3 months had a 51% higher risk of Alzheimer's disease. Long-acting ones like Valium are even worse. Building up in brain fat and causing confusion, patients often describe feeling like a zombie, dull, detached, unable to focus. And here's the catch. When you try to stop, withdrawal makes anxiety and insomnia worse, trapping you in the cycle. Mistake number 3, ignoring poor sleep habits. This is the mistake almost everyone makes. Poor sleep hygiene is one of the biggest hidden drivers of dementia. During deep sleep, your brain washes away toxic proteins like amyloid beta, but if you sleep less than 6 hours, those toxins build up. Studies show chronic poor sleep raises dementia risk by up to 45%. It's not just about hours either. Late night screens, inconsistent schedules, and caffeine all wreck your brain's nighttime cleaning cycle. Mistake number 2, drinking too little water. Dehydration is one of the most underestimated mistakes. Seniors lose the ability to feel thirst as strongly, so many simply don't drink enough. Low hydration thickens the blood, reducing oxygen delivery to the brain. It causes confusion, dizziness, and memory slips that mimic dementia. A study in Age and Aging found that seniors who were chronically dehydrated had double the rate of cognitive decline compared to those who stayed hydrated. Mistake number 1, mixing multiple brain-blocking medications, polypharmacy. The most dangerous mistake isn't one pill, it's the combination of many. This is called polypharmacy. Imagine you take diphenhydramine for sleep, oxybutynin for bladder, and a statin for cholesterol. Each alone raises dementia risk slightly, but together they stack up and create an overwhelming anticholinergic burden. A 2022 study of 280,000 seniors found those with the highest anticholinergic load had a 120% increased risk of dementia within 10 years. That's more than double. Call to action. Here's the truth. Dementia isn't always inevitable. Your brain is resilient, but only if you protect it. By avoiding these 8 mistakes, you can dramatically lower your risk and even reverse drug-induced memory loss. Now I want to hear from you. Have you made any of these mistakes? Have you noticed brain fog, pain, or forgetfulness in starting a new routine or medication? Share in the comments. Your story could help another senior recognize the warning signs. If you found this video helpful, please give it a thumbs up, share it with a friend, and subscribe for more senior health tips.